Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I would like to talk about what to expect at your skin cancer screening. If you are having a skin cancer screening, you're going to need to get pretty much naked, and we will give people a gown. The dermatologist should check you from head to toe, including between the toes and in the scalp. I have people keep their underwear on, and I work around it and ask before checking in the groin to give patients a choice about that. Some doctors may ask to have all the clothes off, and that is also appropriate and fine. It is easier if someone takes their bra off, but again, I can work around it if I need to. When I walk into the room, oftentimes people have their socks on, and that does not work. The socks have to come off. Ideally, nail polish is off for an accurate nail exam. I often find the scalp hard to check in some people who have very thick hair, and I will ask those patients to have their hairdresser take a look while their hair is wet and they're combing through it very carefully. And if they find anything, to try to get a picture, and then we can go searching for that spot. While I'm doing the skin cancer screening, if I find anything unusual, I will take photos for the chart, and then we can watch it over time to see if anything is changing in the future. In my opinion, a picture is worth 1,000 words. I will also look at specific lesions, especially moles, with my derm light, which is a little instrument. It's a little light and magnifier that has a special kind of light called polarized light. It allows me to see a little deeper into the lesions better than what I can just see with the naked eye. And that can help me determine whether it has benign or worrisome aspects to it, whether or not it needs a biopsy or follow-up. So I find the derm light very useful to use during skin cancer screenings. For my patients, I will have them sitting on the table, and I will start with their hands and do their arms, and then do their face, their head, their neck, and their ears. Then I prefer them to lie down, preferably on their back first, and I will check the whole front of their body. And then I will have them flip over, and I will check the whole back of their body. Some doctors will do all of that with the patient standing, which is a different way of doing it, and that's fine. I prefer the patient lying down. For me, it's better lighting, and that's just what I am used to. But there are a good number of patients who cannot lie down flat. And in that case, I will just have them stand and twirl from one side to the other side and turn with me sitting so that I can see everything. If I see a patient with a lot of atypical moles, I will often send people to something called Mole Safe. It is a photography system with polarized light. It is not available in all areas of the country. I explain that it's another set of eyes to me. It doesn't take the place of me or from a dermatology exam, but it does give a more complete view of particularly moles. And they get read by a dermatopathologist at NYU, and the moles get a risk score, whether they're high or low. And it usually puts people at ease because they image many different moles, and most of them are fine, and it can help us determine which ones are the highest risk that we need to focus in on the most. I will also request, if it's a new patient, that if you've had biopsies, to please bring me copies of them. It's best to get them for your own records and then to bring them with you, and either I copy them or you bring me a copy and I can scan it into your chart. A lot of people will say, oh, I had that taken off, it's benign. Oh, I had that taken off, it was a skin cancer. But there's nothing like having the actual pathology reports is extremely useful. So it's good to have for your own records, and it's very helpful for a new doctor who is now going to be following. So in case there's anything regrowing in a scar, we have evidence of what it was when it was biopsied. And that's pretty much it. I recommend skin cancer screening yearly for most adults. More often if you have a personal history of skin cancer or a very strong family history of skin cancer or lots of moles and old sun damage. I will do skin cancer screenings on children upon request. That's usually for people who have a family history. Without a family history, I would usually recommend starting around 18 or so to get a baseline. I hope this puts you at ease that a skin cancer screening is nothing crazy. It should just be someone, preferably a board-certified dermatologist, looking over all of your skin to see if there are any suspicious lesions. If the doctor finds any, typically it will be a biopsy at that time or sometimes photography and watch it depending on what the lesion is. So if you haven't had your skin cancer screening, now's a great time to call the office or call your dermatologist and get it scheduled. Reminding you that skin cancer is usually curable if it is caught in time, so there's nothing like letting an expert board-certified dermatologist look you over from head to toe and determine that everything is okay. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.